What are cross-infection precautions for cystic fibrosis? Living with cystic fibrosis means being extra careful about infections. Cross-infection precautions are vital for people with cystic fibrosis to avoid sharing harmful bacteria that can worsen lung health. Individuals with cystic fibrosis are especially vulnerable to infections from bacteria like Burkholderia cepacia complex and Pseudomonas aeruginosa. These bacteria can spread from one person to another, making it crucial to take precautions. First, education is key. People with cystic fibrosis should learn how to manage their respiratory secretions. This includes coughing into tissues and keeping a distance of at least 3 feet from other cystic fibrosis patients. This distance helps reduce the risk of airborne transmission, even if test results are negative. It is important to remember that respiratory secretions can carry unseen microorganisms. Hand hygiene is another essential precaution. Everyone, including patients, families, and healthcare workers, should wash their hands thoroughly or use alcohol-based hand sanitizers before and after contact with cystic fibrosis patients or their surroundings. This practice helps prevent the spread of germs. Personal protective equipment, or PPE, plays a significant role in protecting health. Healthcare providers and caregivers should wear gloves and gowns when caring for cystic fibrosis patients. Masks may also be necessary, especially if there is a risk of droplet transmission. In healthcare settings, specific precautions are in place. Patients with certain infections, like MRSA or Burkholderia cepacia complex, may be placed under contact isolation. This means healthcare workers will wear gowns, gloves, and sometimes masks to prevent the spread of these pathogens. Social interactions also requiring caution. People with cystic fibrosis should avoid indoor gatherings where the risk of transmission is high. Many cystic fibrosis centers recommend that individuals who have cultured certain high-risk bacteria in the past year refrain from attending events. Cleaning and disinfecting equipment is crucial as well. Respiratory therapy devices and clinical tools must be thoroughly cleaned between uses. High-touch surfaces in both clinical and social settings should be regularly disinfected using hospital-grade disinfectants. Environmental controls are implemented in cystic fibrosis clinics and hospitals. Infection prevention protocols, including checklists and audits, help maintain consistent practices. Collaboration with infection prevention teams ensures that everyone follows the necessary precautions. Finally, individual risk assessments are important. Since no environment can be completely free of germs, individuals with cystic fibrosis should consult their healthcare providers. This helps evaluate the risks and benefits of attending events or receiving care in various settings. These cross-infection precautions reflected the current medical consensus and guidelines from cystic fibrosis foundations and infection control experts. They are designed to protect the health and lung function of those living with cystic fibrosis while supporting their quality of life. Always consult healthcare professionals for personalized advice and guidance.